Welcome back. We're talking to Professor of Vaccinology, Professor Shabir Mahdi. We're talking about the spike in cases, positive cases and deaths with regards to COVID-19 in the country generally, but we're also looking at Gauteng. We're also talking about how the virus sheds. So, Professor, you were just finishing off your train of thought earlier on when you were explaining what we mean that the virus spreads through the airways. You were speaking about coughing. Please continue.
So like I was mentioning, when you talk of airborne spread, it's one of two routes to which the virus is spreading. The first way is when people are within close proximity to each other. As an example, within 1.5 meters of each other. If the one person is talking or coughing or even breathing, they're able to release micro droplets. And those micro droplets which are contaminated with the virus can land on the mucous membranes in the eyes, in the mouth, in the nose of a person that is speaking to, and the person can become infected. That's commonly what happens is if people are in a very confined space where there's very poor ventilation, when someone speaks, again, you're releasing these micro droplets which can remain in the environment for 5 to 10 minutes. And people can actually breathe that in. And that itself can cause an infection. But the main way to actually prevent it is really to use this sort of non-surgical face mask which prevents a person that's infected, knowingly or unknowingly, to release these contaminated droplets into the environment.
So the duration of the viral shedding itself varies significantly between studies and apparently may depend on the severity of the disease or the nature of the study itself. What I'm curious about is, are there any continental or atmospheric differences?
So there is a school of thought which indicates that the virus might transfer much more efficiently in cold weather as well as when there's low levels of humidity. So there's a recent analysis that was done which supports that climatic conditions might very well assist the virus in terms of its ability to transmit. And it's both related to the people that are getting infected in terms of an increased susceptibility as well as the ability of the virus to survive for a longer period of time when it's cooler as well as when it's less humid.
And I think it's important for us to understand that considering that we are already within our winter month period. Professor, please talk to us about PCR, what it is and what are the levels of its detection and positivity, and if it's possible, especially during mild to medium cases, for someone to actually take care of themselves at home.
So what the PCR test is, it's really to try to find genetic material of the virus in someone that's infected. So what we usually do is take a nasal swab, and then that is tested to look for the genetic material of the virus, and it tells us whether a person is infected or not. When a person is infected, that test can remain positive for up to even 6 weeks, but it doesn't mean that the person is infectious for 6 weeks. So the person needs to be most careful at least about 7 to 8 days after the onset of symptoms. That is a period of time when a person is most infectious, which means that they're most likely to be able to infect other people in the environment. Now, unfortunately, when someone is infected, the reality is that if it's a mild illness, fortunately, there isn't much that we can do, but at the same time, it is going to resolve on its own. So usually it's just a matter of symptomatic management, ensuring that you get sufficient exercise, ensuring that you're still having a good balanced diet. So there isn't any other magic therapy that we've got to assist someone with mild illness. If someone ends up in hospital, then we do have some options available to us to try to improve the outcome and to speed up the recovery. And key to that is basically something as simple as oxygen, supplemental oxygen. And then as you've heard over the past few weeks, there's a role for steroids in terms of improving the outcome of severe cases.
Professor, we'll talk about the swine flu that's been detected in China in just a moment, but I want to stay on the flu and cold symptoms, or if you feel that you have difficulty breathing, what can you do? What can you take? We've seen a lot of information being shared about drinking all kinds of things, including vitamin supplements, but what would you recommend that people do to boost their immune systems? And if you have difficulty breathing, are there exercises that you can do, for instance?
Yeah, so I think what you're raising is an important point. If someone is having chest pain, so having difficulty with breathing, that person needs to go to our hospital immediately. There's no exercise that you should be engaging in if you've got chest pain or difficulty with breathing. When you're having difficulty with breathing, it indicates that the amount of oxygen in your body is dangerously low, and that's the reason you experience difficulty. And the only treatment that you've got for it is oxygen therapy. So those individuals need to go immediately. If you've just got a fever, a runny nose, a sore throat, as an example, again, it's really about having a balanced diet. There aren't any vitamins or minerals that you can take, which is going to assist you in that acute phase that we know of, which basically expedites your recovery. So it's about having a balanced diet. It's about having a healthy lifestyle. But if you've got chest pain, if you've got shortness of breath, it's better to get to a hospital sooner than later, because the earlier we start treatments such as oxygen and steroids, the better the chances are of an improved outcome.
All right. Final question, Professor. As I mentioned, Chinese researchers have apparently discovered a swine flu strain, which has the potential to be a pandemic, we're told. What do we know of it, and how difficult can it make the situation for us here at home?
So this particular virus that's been identified is an H1N1G4 type of virus, which basically means, it doesn't mean much at the moment. This virus actually has been identified for almost 5 years now. So it's not a new novel virus that's emerging, but what is happening is that the virus is mutating, and over time it might actually become a problem for humans as well. But like I said, the virus has been circulating for some time. It's not a completely novel virus, unlike SARS coronavirus 2. And at this point in time, there hasn't been any evidence that it's actually able to transmit between pigs and to humans, or between humans. So I think that's one of our lesser concerns at the moment. It's something that we need to keep an eye on. But the most pressing issue at this point in time is how to deal with COVID-19.
Professor of Vaccinology at Wits University, Shabir Mahdi, thank you very much for taking the time to speak to us.